Now it's time to work the knee joint itself. So for this, I like to get a towel, and you might need a couple different thicknesses of towel. Start with the most thick of towels, and then we're gonna reduce the thickness over time as our knee continues to move. Now the position of the towel is really important. So you're gonna actually position this below the kneecap, okay? So technically on the back of your shin bone here, okay? Not on the thigh bone, the femur bone, right on the tibia here, okay? So once it's positioned in the back of the leg, kind of right on the calf, we're going to take two hands, and we're going to be very easy with this. And it's not because we're concerned about harming anything. It's more if we go too aggressive, our muscles are going to contract and reflexively guard, and again, it's going to be fighting us. So I'm going to take both hands. I'm going to grab my thigh, all right? Just kind of avoid incision if your incision's still healing for now. And what we're going to do is just little light oscillations down and up. Nice and easy. And you don't want to push into significant pain because, again, your muscles aren't going to like that, and they're going to fight you. We want as much relaxation as we can, and we're just going to work this extension. So I would say about 10 to 15 light oscillations, keep it tolerable. And then after that, take away some of the towel, reduce the thickness. And now we're going to go a little further in the range of motion. And same thing, 10 to 15 reps. See how far you can go, should be light. And then after that, take the towel away. And now we're a little bit straighter. 10 to 15 reps. And then if you start to have more reactivity or more soreness as you're doing this, that's your indication to rest and allow it to recover. But as your reactivity, soreness, pain response allows, we're trying to get further and further into range until we're eventually as straight as we can be.